My name is Amol Nergudkar, the CEO of Patient Prism, and I'm delighted to welcome Rachel Wall from Inspired Hygiene into our studios this morning. And Rachel is a well-known consultant, hygiene consultant. She's a well-known speaker. She speaks at almost all the dental conventions out there. And she's helped dentists tap into hygiene's profit potential over the last 20 years. Has done some amazing work. And my first question to her really is today is, what do you think are the top 5 hygiene benchmarks that you look at when you go into a practice and that you want to improve? I mean, in a financial world, we call them key performance indicators, right?
Yeah.
What are those 5 top benchmarks that you look at as you evaluate a practice and you take them on the journey to hygiene greatness or dental practice greatness?
Well, obviously, Amal, we always want to look at what are their objectives, what's the practice owner's objective, to improvement for the hygiene department. Sometimes it is tangible, sometimes it's intangible. But as far as the things that we can specifically measure, we always like to look first at the Perio percentage. One of the benchmarks that we suggest is about 35% Perio, and that is pro fees compared to scaling root planing and perio maintenance. And that is a big indicator because very often when the perio percentage is really low, it indicates other issues. Could be scheduling issues, not enough time on the schedule to get these patients back for treatment. A lot of times the dentists say, hey, I've done a lot of CE and really invested in myself, but the hygiene department has gotten left behind unintentionally. So that's one of the first things we look at is that 35% perio awareness. The next one we look at is profitability. How profitable is the hygiene department for the practice? So one of the ways, the easy math to do that is that hygiene should be producing at least 3 times their compensation. And then that way we feel like they've reached that first level of profitability because every department in the practice should be creating profit for the business. That can be reinvested, and just profitability is a sign of a healthy business. The next one is open time. So we believe that there should be less than 8 to 10% of open time, which means unutilized time in the hygiene schedule. So, and what we often find is if that number is upwards to 20%, a lot of times practices will just assume that it's a cancellation and no-show issue. But sometimes it can be a supply and demand issue. Maybe they have a lot more hygiene hours and they just haven't grown into that yet. So if they know that, then that's okay. What are we going to do about that? And do we have these additional hygiene hours so that we can expand and grow, right? Accept more new patients, do more high-level treatments. But 8 to 10% is typically the range that we want to see that in, or less. And then 60% of restorative should be enrolled through hygiene. And this is a combination effort, right, between the hygienist and the dentist. But we really feel like a large percentage of that doctor's treatment should be coming out of the hygiene department, and that the hygienist should have that confidence and be really empowered and supported to really tee up that treatment for the doctor. And then number 5, which is kind of the bonus, is we look to see how open-minded are the hygienists, how open are they to learning and growing, what is their attitude towards being coached to improvement, because if they're ready to go and they're excited about learning and growing in a positive environment, then all these benchmarks are going to improve with training.
These are excellent benchmarks because you've got to be able to, as everybody has said in dentistry for the longest time, that if you have a great hygiene department functioning optimally, you're going to have a very profitable practice. And whether you are one practice location or you have hundreds of practices across the country, making sure that you're looking at these 5 benchmarks. Not only at the beginning, but also throughout. I mean, you need to be monitoring how well, because people will do certain things and they'll go back to their old habits. Excellent segment on the 5 benchmarks. So I look forward to this conversation more. Thank you so much.
Absolutely.